Assalamualaikum and very good day to our lecturer, Madam Shamim binti Abdul Halim. So, we are from CS25936. We are going to present how AI help to fight against COVID-19. My name is Muhammad Amir Shakib Rosdi and our team members is Abdul Azim bin Ismail, Nuraiman Haris bin Abdul Rahim, Muhammad Nawawi bin Azmi, and Muhammad Nur Ikmal bin Chabidin. What is the background of COVID-19? Coronavirus disease 2019, or commonly we call as COVID-19. It is an infection disease which was identified the illness case in Wuhan City, which is Hubei province in China, reported on 31st December 2019. On 30th January 2020, World Health Organization, commonly we call as WHO, declared the COVID-19 outbreak a global pandemic. The common symptom of COVID-19 is fever, dry cough, and tiredness. Artificial intelligence role in healthcare response to COVID-19. The COVID-19 pandemic has accelerated effort in incorporate AI into clinical care. At the time when, in many countries, healthcare systems are facing unprecedented strain on their resources. Prior to COVID-19, AI was already being widely exploited in healthcare, and review are emerging of how it may assist in effort to combat the current pandemic. AI is one of the such technology that can track the spread of virus easily, identify the high-risk patient, and useful controlling. By analyzing the previous data of the patient, it can predict risk on future patients. It may identify patients at risk of clinical deterioration and poor outcomes, and pinpoint existing drug for repurposing to treat the disease, propose new compound for development, and suggest immunogenic viral protein as target for vaccines. Next is AI application during COVID-19 at different stages. I'm going to expose all the stages, but then my other members will explain more detail. So move on to, for the first stage, we have detection, which is it has early warning and diagnosis. On the second stage, we have prevention by prediction, surveillance, and information. On the third stage, we have response by doing the delivery and service automation, and finally we have recovery by monitor. Next, I'm going to pass the session to Azim.
Hi, my name is Abdul Azim bin Ismail, and today I'm going to talk about AI application in COVID-19 on surveillance. So, what does it mean by surveillance in this context? Surveillance is to monitor and track contagion in real time. A number of countries are using population surveillance to monitor COVID-19 cases to each person indicating contagion risk using cell phone software. A machine learning model uses travel, payment, and communication data to predict the location of the next outbreak and inform border check. Search engine and social media are also helping to track the disease in real time. Many countries such as Austria, China, Poland, Singapore, Korea, and many more, including Malaysia, have set up contact tracing system to identify possible infection routes. For example, in Malaysia, we have MySejahtera apps that have been created by the Malaysian government that may help Minister of Health (MOH) with COVID-19 clinical and epidemiological analysis. Alright, that's all for me. We continue with AI application on prediction.
Assalamualaikum, my name is Nawawi. Today I will present to you about the AI application. After the AI application makes the surveillance, the next step of the application do is to make a prediction. Now, for the predictive models, able to identify on admission, patients likely to deteriorate and require respiratory support can assist triage and resource allocation decisions. While older age, male gender and certain comorbidities such as hypertension, cardiovascular diseases, and diabetes portend worse outcomes. These factors do not necessarily predict outcomes at the level of the individual, especially in younger patients. Some machine learning or ML algorithms can more accurately estimate risk of death, development of acute respiratory distress syndrome or ARDS or ARDS, and duration of hospitalization. The dedicated platforms or fora allow the consolidation and sharing of multidisciplinary expertise on AI, including internationally. The US government, for example, has initiated a dialogue with international government science leaders that includes using AI to accelerate analysis of coronavirus literature made available using the Kaggle platform.
And for the next part is how AI helps in monitor the COVID-19 patients. For patients who are diagnosed positive with COVID-19, some patients get to manage their symptoms self-isolating at home while the others must be hospitalized to be monitored by the doctors and nurse. For self-isolating patients, they must use monitor applications such as Mayo Clinic's remote patient application. And this is where the AI plays a big part in monitor the patient with COVID-19. This monitor application helps the patient to stay connected with a team of experts and getting support they needed. There will be a specific device handled by AI to measure the temperature, blood pressure, and oxygen levels. This data will be delivered to the virtual care unit located in certain big hospitals. AI-assisted analysis will alert the staff if the condition of the self-isolation patient is getting worse. This AI also can build an intelligent platform for automatic monitor and prediction of the spread of COVID-19. A neural network can also be developed to extract the visual features of this disease, and this would help in proper monitor and treatment of the affected individuals. It also has the capability of providing day-to-day updates of the patients and to provide solutions to be followed in COVID-19 pandemic.
Hi, my name is Muhammad Noor Iqmal and I will explain about the diagnosing COVID-19 in sick patients presenting to hospital. It is currently performed by RT-PCR, testing of nasopharyngeal and throat swabs. However, initial tests may only be 70% sensitive and turnaround time can be 24 hours or more. Machine learning models combined with virus detection system using CRISPR, a tool which uses an enzyme to edit genomes by cleaving specific strands of genetic code, can rapidly design SARS-CoV-2 assays which have high sensitivity and speed. AI has also been used to design within a few weeks point-of-care immunoassays for detecting viral antigens within 20 minutes, and prototype testing kits are in development. Rapid diagnosis is key to limit contagion and understand the disease spread. Applied to image and symptom data, AI could help to rapidly diagnose COVID-19 cases. Attention must be given to collecting data representative of the world population to ensure the scalability and accuracy.
For the conclusion, artificial intelligence is an upcoming and useful tool to identify early infection due to coronavirus and helps in monitoring the condition of the infected patient. It can significantly improve treatment consistency and decision-making by developing useful algorithms. AI is not only helpful in treatment of COVID-19 affected patients, but also for their proper health monitoring. It can track the crisis of COVID-19 at different scales such as medical, molecular, and epidemiology, helping patients. It is also helpful to facilitate the research on this virus using analyzing the available data. AI can help in developing proper treatment regimen, prevention strategies, drug and vaccines development. That's all for our group. Thank you for listening.